Hello, everyone. Hi there. I'm just waiting for a couple people to join, a couple more people to join. I hope you all are doing well right now. If you see me looking over this way, I'm just looking at my laptop for some notes. I will introduce myself in a little. I'm going to go ahead and comment in the chat the Instagram of the CSU Chico WellCat Health Center, which is the service that we'll be talking about today. We'll get to meet Jill. Hi, everyone. Give us a wave if you're here. We're excited to have you join us on Instagram Live. CSU Chico WellCat. Hello, thanks for the wave. I'm just typing in the chat right now the Instagram handle of the CSU Chico WellCat Health Center that you all should follow. Again, Health Center. Let me just make sure. CSU Chico WellCat _ Health Center. And I'm going to go ahead and pin the comment. Go ahead and follow the CSU Chico WellCat Health Center, CSU Chico WellCat _ Health Center. It's in the comments. I see that they've joined us. I'll go ahead and introduce myself briefly. My name's Pat. You can call me, my full name is Patricia. You can call me Pat. I am going into my final semester at Chico. I'm in the nursing program. Super excited to be here and get to talk with Jill today from the CSU Chico WellCat Health Center. And I'll go ahead and add her now to our Instagram Live, and she will tell you about all of the awesome services that they have and how to utilize them this semester. I just invited. Hi, Jill.
Hi. Hi, Pat. How are you?
I'm doing great. Thanks for coming to chat with us today.
I'm just ahead here. Let me fix that.
Me too. I've been minimized to ahead. Well, we're happy to have you here. If you just wanted to start off by introducing yourself and what program that you represent on campus, that would be awesome.
Okay. Can you hear me okay?
Yeah, I can hear you great. Yeah.
Awesome. Okay. I'm Jill Canaday, and I'm the clinic administrator over at the WellCat Health Center. Some people, if you've been here a while, might have known us as the Student Health Center, but we rebranded. So we want to be positive and we focus on wellness. So we're the WellCat Health Center.
Awesome. And then I also forgot to add for our followers, if you have any comments or questions, just go ahead and comment them down below, and I will read them aloud and hand them over to Jill. So at any time, if you have any questions, just go ahead and put those in our comments.
Totally.
Okay, yeah. Could you tell us a little bit about what the mission or values of the health center is, and what kind of, I know you offer lots of services, so if you just want to get started on any of them, that'd be great.
Okay, cool. Well, first of all, thank you so much for inviting us. Obviously, there's so much going on in the world right now that focuses on health and this COVID virus, which we'll talk a little bit about. But I think the silver lining to that is that people are really focusing on their health. So the health center is here. We were here in the spring. We're going to be here all fall. We're open Monday through Friday, 8 to 5. We're closed for lunch from noon to 1. But we offer so much for students. We have pharmacy, we have x-ray, we have a full lab. Our pharmacy has like amazing over-the-counter medicine, super cheap. We don't make money off of it. We're not about that, you know.
I can attest to that as a student in my 5 years of experience there. I get sad when I go home and I have to go back to my pharmacy here. So
Yeah, it's the nice thing about the pharmacy too is it's available for staff and faculty.
Oh,
Most of our services are for students only, like the lab and X-ray and being seen. But the couple of things we do offer to anyone on campus are our flu shots, which we do have coming up. I don't have exact dates yet, but hopefully I'll be able to get to work with you because we usually work with nursing
yeah,
students.
yes.
Yeah.
I hope so too.
So again, if you follow us on our Instagram, we have an amazing person running our account. It's not me. Miranda does a great job, and she keeps us up to date with things that are happening. And so when we get our flu clinics lined up, we'll have that on there.
Awesome. It,
But in terms of like other services, I think people should realize we have a couple of amazing triage nurses. So if you call right now, you don't have to come in. You can talk to Kylie or Macy, and they can try and help you over the phone. And if they feel like you need to talk to a provider, you still may have just a phone conversation with like a doctor or a nurse practitioner, so you may not have to come in. We are open to having people come in. We're doing everything by appointment,
okay.
so we can kind of control the flow. We don't
Mhm.
have people sitting near each other and that kind of thing. So you're in, you go see your provider, you might go to the pharmacy, and then you're all done. So we're trying to just streamline that, but we're totally seeing people for, like birth control and our normal exams, let alone maybe you woke up with, I don't know, a sore throat or you sprained your ankle, like all of those things that we would normally do, we are still doing them.
Oh, that's great to hear. Are these services covered in the prepaid student health center fee or
Yes.
okay.
Yeah,
So
and that's really, I'm so glad you asked me about that because we do have some students that all of their classes were maybe virtual, so maybe
right.
they stayed home, maybe they're in San Jose or San Diego, and when you pay that health fee, it actually gives you access to all 23 campuses for their health center. It's called a reciprocal agreement that we have. So I would recommend that you, again, follow us. We have a post that lists every single health center in the 23 campuses and their phone numbers and their addresses. Call them and see what exactly they offer and how to utilize that health center. But if you're staying in San Jose, you can totally go to San Jose State and get seen because you paid that health fee here. And then if you're in our community, that is what covers it. There's a couple of things that aren't covered, like if we have to send a lab out to Quest, we just charge the student whatever Quest is charging us. Or if we recommended like a walking boot, you have to pay for the walking boot. But we don't mark things up, so we keep it as cheap as we can for students.
Okay, that's awesome. So you've covered like reproductive services and medical services, lab work you said they do,
Yeah,
x-ray work, right?
yeah.
How about do you have any services for like mental health counseling or any partners that you have on campus that you'd like students to know about?
Absolutely. We do a couple of things for mental health right here in our clinic. We have one of the counselors actually has his office here, and you can call and get an appointment with him. We have telehealth for actual psychiatry, and we work with Dr. Yu, and he is amazing. Our students love him. So if you want to speak with a psychiatrist, maybe you had a psychiatrist at home that was prescribing meds and you wanted to continue that here, we can do that. When you call, just let our reception staff know what you used to be, what services you used to get at home and what you're looking for.
Hmm.
We also have our partners on campus, the WellCat Counseling Center, and if somebody is seeing us and they say that they want to speak to a counselor, we'll help connect them. I also recommend our website, the WellCat Health Center or WellCat Counseling, and it'll tell you how to get appointments with the counseling center.
Okay. Okay.
And we do help with, prescriptions for mental health as well. So, our providers are like full service providers, like you would speak to anywhere else.
Okay, so to clarify, if a student had an existing prescription from their hometown healthcare provider, they could refill those at the health center. The
We don't
WellCat.
have a full formulary, but if we don't carry it, we will assist you in getting it somewhere in the
In the
community.
community. Okay.
Yeah, yeah. Our pharmacists are Joe and Annelle, and they're amazing, and they will totally help you figure out which pharmacy in town you could pick up your prescription in if it's not on our formulary.
Great. And then how about after hours, after the health center is closed? Do you have any suggestions of where students can be seen for any kind of medical services in if they're local in the Chico community right now?
Right now, we are Monday through Friday, 8 to 5. We
Mhm.
don't have any on-call providers, but we do on our website, like have under information, we have local, like immediate care, urgent care, and then obviously the directions to like Enlo.
Yeah.
That's, I guess the bonus to Chico is there's not like, I mean, everybody kind of knows where Enlo is,
Yeah.
right? But we do
Yes.
have that information. And the one thing that we do have after hours is our COVID hotline, and I want
Okay.
to give that number. It's 530-898-2222. So if you have any questions about resources or whether your symptoms are something you should get tested for or where to get a test, the hotline won't be answered at like midnight, but if you leave
Right.
a voicemail, we get back to you within 24 hours.
Okay.
So yeah.
And then just speaking on COVID-19, what can you advise students how to stay safe and healthy as can be and protect our campus community? Just to remind students, I know we've heard it all, but what would you like to say to our followers watching about how to keep our campus safe? Yeah.
Here's my mask. It's very weird for me to have it off, but I'm in my room with my door closed. Honestly, and I have a student that goes here, and I know it's such a difficult age to hear that you are supposed to say social distance and keep your masks on and not gather and do some of those things that we think of as traditional college, things that I have the right to do when I go to college. Totally get that. I am a WellCat alumni and I love this community. And I think just for a few months longer, we really have to be conscientious of what we're doing and follow those guidelines.
Right.
Wear your masks when you're out and about. Make sure you're not wearing it. Don't wear it like this,
Yeah.
right? Over your nose, over your mouth. Try to avoid going to those gatherings. Don't go to those parties, especially this upcoming weekend, right? This is a
Right.
weekend that we all like to get together and have a barbecue, but this is not the year to do that. And
Hmm.
I think the sooner that we all get on board to do that, we can bring our numbers back down, and then maybe we can enjoy what we all know and love about Chico State, which is our beautiful campus and our
Yeah.
amazing, all the clubs and the sports that we do. We want to bring those back as soon as we can, but honestly, the best way to do it is to follow the guidelines right now.
Agreed, agreed. Thanks for giving that reminder. And then for the services that you talked about, who can utilize the services? What kind of, do they just need to be a student at Chico State? How can,
Yeah,
yeah.
pretty much any student that's coming to Chico State has paid their health fee. If they're not sure, I know you can like log into the Chico, I think it's a student center, and see what it is you paid for in case you are maybe taking only like a class, but I'm pretty sure everybody pays for the health fee. So you are, we can always look you up if you're not sure. You can call our number and we can help with that.
Mm-hmm.
Like I said, we don't see faculty and staff or anybody in the community. We only see as patients the students of Chico State and any other CSU.
Okay. Are you open during like breaks and stuff like Thanksgiving break or those like school holidays?
Typically, we like during winter break, I think we have a few days off around actual holiday of Christmas, but like we're open all of January. And I think for Thanksgiving break, we're always open Monday, Tuesday, Wednesday, and then we
Mhm.
have like Thursday, Friday off. But we always are updating our website, and we'll put signs on the door and we try and post it on our social media. So we have like, I think whatever the state typical holidays are, like New Year's and 4th of July, those kind of dates we're closed, but
Okay.
we don't follow just the academic calendar. Like spring break, we're open, summer break, we're open.
Good to know. Great.
Yeah.
And then you touched on this already, but how will this experience using this service be different this semester? It doesn't sound like it'll be, I mean, really too much different besides no walk-ins, just go on, or sorry, call to make an appointment. Or can you do it online as well to make an appointment? Or,
We worked so hard and we were so proud of our online appointments. We had just opened that up in the spring and it was working really well. But because of COVID and us wanting to really keep track of the flow, we decided to close that back down. So we don't have the online right now, but if you call, we We do not have a long wait for appointments.
Okay.
We do have even appointments for lab. We have appointments for pharmacy. It sounds kind of silly, but we want people to have that space. So we have like really short appointments if you need to go to pharmacy. And if you're seen here in the health center and you need pharmacy, you don't need an appointment. We're just going to walk you over there. But, if you're at home and you're like, hey, I want some Tylenol or some Claritin, you
Yeah.
can just call the pharmacy directly and they'll make you a quick appointment and you can come in. And we screen everybody. We take their temperature,
Okay.
but other than that, we have all of our services available, full services.
That's great to know, and especially too that if students are staying in their hometown, it sounds like they can go to the nearest CSU near them if they need in-person services, or just give them a call, give you all a call, and then you can direct them to the best
Yeah.
way to get that service too. Okay.
And if they're really not sure about going somewhere that, unfamiliar to them, there's a lot that we can do over the phone. So
Yeah.
feel free to give us a number or call. Our main line is 898-5241. And if there's any way for us to help you over the phone, we will do that. And if not, we can help direct you to somewhere that's local, that it's a CSU.
Yeah. Thank you for being there for us Wildcats. Is there
Oh,
anything?
of course.
Yeah. Is there anything new this year? Any like particular services or anything that you want to highlight? Anything new that you have?
Well, it's a little bit exciting. We've
Oh,
been waiting a long, long time. We still have carpet in parts of the health center,
yeah.
which as a nursing student, it's like that's not pretty normal, right? So we have a building fund and we dipped into that a little bit and we are getting rid of the carpet and we are getting rid of some old like wallpaper. So it was supposed to happen this summer and we were going to like close down and move out into a different place. But with COVID, it kind of took longer for the contractors and everything to get set up. So we actually started a couple of weeks ago, and hopefully by December 1st,
Okay.
we will have no carpet in the health center. So we'll have new flooring and the walls will have fresh paint on them. And, it's going to look so amazing. And we're going to have better lighting that they're doing in other parts of the campus. They're doing our building as well. So as a nursing student, good lighting is awesome when you're trying
Yeah.
to assess somebody, right?
Yes.
So we feel like
Yes.
it's all tied into like safety because we don't
Right.
want carpet where you can't really like
Uh-huh.
disinfect that.
Yeah.
So it's going to look nice, but it's also going to provide a cleaner area for all of our students to come visit. And we are so excited at how it's going to look. So hopefully around December 1st, the COVID numbers will be down and maybe we'll be able to have a little open house and show
Oh, that'd
everybody.
be
Yeah,
awesome. That's very exciting. A good makeover, and again, like just productive for the environmental like safety
yeah, for
of
sure.
the health center too. We are looking forward to it.
Yeah. So when you come right now, there's like some Visqueen and there's boxes in some unusual spots, but it will soon be gone and it'll look amazing in here.
Cool, cool. And then my last couple questions is for students who don't have insurance, is that a problem? Just as a prospective student, they think they don't have insurance, are they still able to come to the health center?
That is an awesome question. For us, it does not matter.
Okay.
If you see one of our providers, let's say you broke your wrist or something, we have splints. So if you had something that was like a sprain or a strain, we could handle that. And we would certainly put a temporary sort of splint on you, but that would be something that you would need to follow up with at Enlo. We could even do an x-ray and tell you that it's broken, but we would need you to follow up outside in the community. For those type of things, we would help you with a referral. We have Satya is our referral coordinator. She's awesome. And those kind of things, that's when insurance comes up. But for anything that you do inside our center, you don't need insurance at all, just your health fee.
Okay, I hope you all heard that. So no insurance needed, and they are there for you, WellCat students. And you also do some kind of assistance with if they needed to apply to like Family Pact or Medi-Cal, right? Those rural assistance programs.
Specifically Family Pact. Sally is our Family Pact enroller, and she knows everything about Family Pact. She is such an amazing resource.
Mm-hmm.
So Family Pact is a state program for family planning, and it helps cover, especially for long-term reproductive like implants, right? So we call them a LARC.
Mhm.
So an IUD or the Nexplanon, because those can be really expensive.
Yeah.
So if you have Family Pack, then we are providers for that, and you could get one of those in here at the center. But it's also a card that you can take with you to other places that are Family Pack providers in California. But we can help enroll you, we can help re-enroll you, we can answer your questions. So yeah, Sally is here, and if you call and ask to speak to the Family Pact enroller, you'll be able to get through to her and have an appointment.
Okay. Okay, I think that was my last question. I know that was a lot of information for those who are watching. This live will be saved. A lot of information, which is a great thing because there are a lot of great services for you all to utilize. And again, this live will be saved. So if you ever want to refer back to something that you heard, you can go back on this Instagram and watch it. And then what do you want to leave our followers with? Anything that you want to talk about for your program? And then again, if you could just state the contact information, that'd be great.
Okay. I think my parting words of advice would be, I know this is a stressful time. I've talked to so many students just in the last few days off of the hotline, and I would say to remember self-care, right? So
Right.
even with the kind of weird air quality that we've been having and the
Mhm.
mask rules, but it's good to like get outside, go for a walk, right? Do things. If you love to read, find a good book to read. Go down by
Mhm.
the creek,
Right.
maybe. Keep touch with the people back at home. Don't let yourself get so feeling so isolated, and just remember that we're here for you. The
Yeah.
counseling center is here for you. The health center is here for you,
Right.
and we have so many people with resources, and we really care about your health, and we want you to be able to. We're going to get through this together.
Yeah.
It's all new territory for us, but we bring a lot of experience, and we care about our students. So if you have questions or concerns, hit us up. We're here for you.
Yeah. Yes. Although this semester may look a little differently, we are still a big campus community, staying connected. So don't be afraid to reach out to us. And then how can one more time your contact information?
Okay, so our main phone number here is 898-5241. The
Okay.
all-important hotline for COVID is 898-2222. And our pharmacy's phone number is 898, gotta get this right, 6068.
And that's also found on your website. And then you have an Instagram as well that we're on right now, CSU Chico WellCat _health center. And then I also saw
Yep,
that you have a Facebook that's been pretty well updated too.
yeah.
So if you don't have Instagram, or if you want to, give this contact out to someone, you can tell them to check Facebook for updates as well.
And we're
Um,
getting close to 1,000 followers on Instagram, and when we do, we're gonna have a prize. So
oh,
yeah, we gave out some
I
prizes this summer. We're going to have some more prizes when we hit 1,000, and we're getting close.
Okay, that's another great reason to follow. Okay, Jill, it was great to talk to you. Before you leave, I found one comment. Jeff
Okay.
from admissions just said, speaking of walking boots, can I somehow donate the one I used last year? It's not gross.
That is so sweet. We can't reuse it, but we do know of a wonderful service. It's called the Shalom Clinic. It's in downtown Chico, and they do no cost and low cost for students and anybody in the community, and they take donations like that. So when people donate things like that to us, that's where we donate it to. And they're always super grateful for things like that, and they'll clean it up and they will definitely reuse it.
Okay, the Shalom Clinic, right?
Uh-huh. Yep.
Okay. Sounds good. Okay, I think Jeff got that note. And I think that was the only comment that we had. I'll hang out a little after Jill leaves, and then if there are any remaining questions, I'll be sure to direct them over to the CC Chico WellCat Health Center. Yeah.
Thank you so much, Pat.
Yeah.
And I have to say, as one CSU Chico nursing grad to almost another,
Yes.
congratulations. Enjoy your last semester.
Thank
I'm
you.
excited for you.
Thank you. I'm sure I'll see you around on campus after when we
Heck
get
yeah.
back. Yeah. Okay.
Yeah.
Thanks, Jill.
Thanks, Pat.
Have a good one.
Bye.
Stay safe, stay healthy. Bye bye. Okay. I don't see any questions. But again, I'm gonna hang out here for a minute or two. Um, And if there's any questions, don't be shy. You can put them in the comments. You can also probably DM them, contact them on Instagram, or give them a call, email. And then if you have any questions for admissions, if you're a prospective student, you can always email us at info@csuchico.edu. I hope you all are staying safe and healthy during this time. We are here for you, WellCat family. Okay. All right. And if there are no more questions, then I'm going to go ahead and log off. Thanks so much for joining. My name's Pat, and have a great rest of your day and a long weekend ahead. Okay. Thank you. Bye.